If you have been doing chin tucks to fix your forward neck posture, you might actually be making your neck worse. See, chin tucks, although commonly prescribed, are really only appropriate for one type of neck alignment. And if your neck is not in that category, most people don't even know if it is, you could be reinforcing the exact problem that you're trying to fix. In this video, I will show you exactly what chin tucks do to your cervical spine and why they are often mismatched with your neck alignment. Stay to the end because I will show you a more effective way to actually start restoring your neck curve if the chin tuck exercise is not right for you. Hi, I'm Dr. Marc Dupuis, a corrective care chiropractor in Sanford, Maine. On this channel, you will learn how to fix your spine and improve your posture so that way you can move better, feel better, perform better, and have overall better health. Every video contains research-backed insights so you can stay active without pain, perform better with expert guidance you can trust. If you want to learn these types of tips and strategies, learn more about corrective spinal care, stay tuned to this channel. Subscribe to the channel below, click on the notification bell so that way you will not miss out on future videos. Your neck is supposed to have a curve. When we are looking at the neck from the side, facing in this direction, we should have a lordosis. It means that the neck curve is orientated like this. That neck curve is very important. It acts like a functional spring to help distribute the weight of the head, which often weighs 10 to 12 pounds in adults. And when we look at the spine from the side, these facet joints are orientated in their best position to allow effortless movement when we have that proper cervical spine. Now, some folks may have forward head posture with the neck curve fairly well maintained. Mainly we have a skull protrusion issue. In those situations, a small degree of neck or chin tuck action can help to get the skull into a better position so that way the cervical curve or lordosis is in the proper orientation. But here is the big picture. A large number of individuals that have forward head posture, they do not have a well-maintained cervical curve. Often they will have a loss of the cervical curve. It's straightening of the curve. We call that military neck. Sometimes, even worse, often after trauma, we'll have a buckle in the neck called a kyphotic buckle where the neck actually curves in the opposite direction. This can result in some pretty large translations forward of the head, some significant forward head posture. And when we start to do a chin tuck where you are driving more force, what we're doing is actually the exact opposite of what we should be doing to try to restore the neck curve so it can function better. When we do a significant, forceful chin tuck exercise, you can even feel it. What actually happens is as that chin translates posteriorly, we actually end up flexing the upper cervical spine. Remember, that curve is supposed to be shaped like this through the whole neck region. So when we do a chin tuck, if we are flexing the upper portions of that cervical curve, we're actually really loading excessive pressure into the discs. We're stretching ligaments that should not be flexed under normal conditions. And you can see how that would be the exact opposite of what we would want to achieve, which is a restoration of the head in the proper position while maintaining the proper cervical curve. So now that you know this information, one important question you might be thinking is, how do I know what my neck curve looks like? Are these chin tuck exercises appropriate or not? Well, the answer is simple. We cannot guess. You shouldn't guess. Your provider shouldn't guess. The only way to identify what your neck curve looks like and if these exercises are appropriate for you is you need an X-ray. X-rays do not lie. They will tell you exactly what your neck curve looks like, and then based upon that, you can choose the most appropriate exercise to restore your proper cervical curve. And contrary to what many people think or say, even some providers may say, well, hey, I can feel your neck to determine what curve or shape your neck. Unfortunately, very inaccurate. There is no reliable study that shows that palpation is able to identify the specifics of what your neck curve looks like. So there's no way around that. You have to get x-rays. And that's why as corrective care chiropractors, with all of our new patients, we do standing weight-bearing x-rays to see what those spinal curves look like under a load of gravity. So now you know why doing chin tucks, especially forceful chin tucks, can actually put abnormal strains into the neck and put the neck into alignments that we do not want. We do not want to mimic abnormal alignments, straight necks or kyphotic necks, which are the signs of a damaged neck. Also, we don't want to train our postural muscles to get used to start holding these abnormal spinal positions. So now that you know this information, we also have to think on a more global scale body-wise. So your neck doesn't function independent of the other body regions. Many people who have forward head posture, it's really not a true neck problem. Look at the common postures that you see out in the general public. If someone has a hyperkyphosis, a severe humping or rounding of the thoracic spine, what can that do to the head? That's right, that can itself drive forward head posture. I've seen people in our office who have had chronic neck pain, headaches. They have a hyperkyphosis. They've been given chin tucks to perform. They're not getting any better. The chin tucks are actually straining and potentially damaging their neck. Meanwhile, no one has addressed the thoracic hyperkyphosis. This is another reason why x-rays are so important and why we have to take a whole body approach to every person that we see. And you as a patient want to work with providers who are treating your body as a whole interconnected system. So many of these folks have to do corrective care protocols that help to restore the thoracic curve, and by doing so, that ends up correcting the forward head posture. There can even be similar displacements in the lumbar spine and pelvis that can have an effect on where your head ends up. So again, this is why it's so critical if we have forward head posture, if we have a lot of the symptoms that are associated with forward head posture, neck pain, stiffness, headaches, we have to really evaluate all regions of the spine that could be contributing to the forward head posture. Now, there is one other exception to the chin tuck rule. Oftentimes when we have had a whiplash injury, oftentimes we can have a weakening of the deep cervical flexor muscles, and there is a way to rehabilitate those muscles, and often patients are lying down, they'll perform a momentary chin tuck and then slightly elevate their head off of the table. That chin tuck allows activation of the deep spinal musculature, and the goal of that exercise is not for postural correction. It's not designed to address forward head posture. That type of exercise is a deep cervical spine flexor rehabilitative type exercise. So that is okay if you've been prescribed that under proper care of a knowledgeable provider. So what should you do if chin tucks are not the solution for your forward head posture? Well, number one, think globally. Think about where the pelvis is. Is the pelvis balanced? What about the thoracic spine? Do we have the adequate thoracic spine curve? We don't want too much thoracic curve. We don't want too little. Sometimes excessive posterior shift can force the head forward to maintain balance. You want to look at shoulders. Oftentimes, with a lot of desk work, perhaps a lot of driving, folks can develop rounding of the shoulders. The neck tends to follow the shoulders. So we want to make sure that the shoulders, the scapula, those are properly balanced. And then, of course, we have to look at the cervical spine itself, as well as we look at the thoracic and the lumbar spine. This is where those full spine films are so important. So that way, if it truly is issue that's centered in neck, then we can match the exercise with your spinal curve, which will give you the best likelihood for successful rehabilitation. Now for the bonus tip. What if you have forward head posture and you have one of the common neck misalignments, such as an overly straight or military neck, perhaps a neck that curves the wrong way, a kyphotic neck or a kyphotic buckle? One of our favorite tools is the prolordotic. This is a glorified bungee cord, TheraBand if you will. There is some rubber housing to protect the skin and a couple of handles. So again, we really have to have x-rays to make sure that that neck is appropriate for this. If it is, we teach patients how to put that into the region where we want to improve the cervical curve. We stretch those bands out, and then there's 3 different positions. We can go to the lower cervical spine, we can go to the mid cervical spine, we can go to the upper cervical spine, and then what we're doing is creating an anterior force while I'm tipping the head back. So what I'm doing is bringing my head back to a more appropriate position while actually trying to restore the proper bend in the cervical spine. Oftentimes patients feel a lot of relief. We've had patients have relief of headaches, neck pain, neck stiffness just with the prolordotic exercise 2 to 3 times a day to mitigate the stress of being forward for so much of the day. A lot of times common work positions at the computer, positions we're in when we're driving. There's a lot of tasks throughout the day that drive our head forward. So if your neck curve is appropriate, the prolordotic is a great tool to help to restore proper head position, reduce forward head posture while supporting the proper curve in the neck. I hope this video has provided some clarity on when chin tucks can help, when they cannot help, and why doing the wrong type of exercise to the wrong neck can actually make your alignment worse. You now know that forward neck posture is not a one-size-fits-all problem, and why your cervical curve actually plays a critical role in determining what type of corrective exercise is best for you. And now you know why it is not a good idea to jump right into doing chin tucks without doing a proper whole body evaluation. If you got value from this video, like it, share it, get the message out, and you may be able to help others solve their neck pain, stiffness, and even headaches. If you want to get a full posture and spinal evaluation, if you want to see if corrective chiropractic care is for you, look for a chiropractic biophysics trained doctor in your area. If you need help locating one, make a comment below and I will share our online directory with you. Subscribe to my channel if you want to make informed decisions about your spinal health and avoid many mistakes that can lead to long-term problems. If you deal with neck pain and you want to learn how to use kinesio tape to support the neck muscles and your cervical spine, watch this next video.